Shoulder pain. The shoulder is the most flexible joint in the body, enabling a wide range of movements. However, this large range of motion can also lead to shoulder joint problems. Understanding the different parts of the shoulder can help you understand how the shoulder works and how it can be injured. The shoulder is made up of 3 bones. The humerus, upper arm bone. The humerus is the longest and largest bone of the upper limb. It articulates with the scapula at the glenohumeral joint, shoulder joint. Scapula, shoulder blade. It is a flat triangular bone, lies over the superior-posterior surface of the rib cage and connects the clavicle to the humerus. The scapula provides attachment to several groups of muscles. The roof of the shoulder is formed by a part of the scapula called the acromion. A hook-like projection from the scapula is called the coracoid process. The clavicle, collarbone. It is a long and tubular bone located between the shoulder and top of the rib cage. The collarbones help support the arm when away from the body. The glenohumeral joint, shoulder joint. It is a ball and socket joint between the scapula and the humerus. It is the main joint connecting the upper limb to the trunk. The end of the humerus forms the ball of the shoulder joint. A shallow cavity in the scapula called the glenoid cavity fits the head of the humerus. The shoulder joint's bony surfaces are covered in articular cartilage. It is a slippery, strong and flexible tissue, allows the bones to glide against one another. This makes the movement as smooth and pain-free. The glenoid labrum is a ring of fibrous cartilage that surrounds the glenoid cavity. The labrum increases the depth and surface area of the glenoid cavity to provide a more secure fit for the half-spherical head of the humerus. This is important because the glenoid socket is so flat and shallow that the ball of the humerus does not fit tightly. So, the labrum provides the appropriate depth to the humeral head. The capsule forms a fluid-tight sac around the joint filled with a viscous fluid called synovial fluid. This fluid lubricates the joint and allows for ease of movement. Glenohumeral ligaments, which are 3 ligaments that reinforce the front of the shoulder joint. It spans from the edge of the glenoid cavity to the humeral neck. Acromioclavicular joint, where the clavicle articulates with the acromion process. The acromioclavicular joint mainly helps facilitate raising the arm over the head. The acromioclavicular joint's bony surfaces are covered in articular cartilage. There are several important ligaments that support the acromioclavicular joint. Acromioclavicular ligament. This connects the clavicle to the scapula at the acromion process. Coracoclavicular ligaments. These ligaments connect the clavicle to the scapula at the coracoid process, which consists of 2 ligaments, trapezoid ligament and conoid ligament. The coracoid links to the acromion by coracoacromial ligament. The sternoclavicular joint. The sternoclavicular joint is where the clavicle meets the sternum, breastbone. It helps facilitate a number of shoulder movements. Rotator cuff muscles and tendons. They are a group of 4 muscles that attach to the humeral head. These muscles are supraspinatus, teres minor, subscapularis, infraspinatus. Rotator cuff muscles help to rotate the shoulder in many directions. They also help keep the shoulder joint stable by contracting and holding the humeral head tightly in the glenoid as the humerus moves. The bursa. Bursa is a sac between the acromion process and the rotator cuff. It contains a lubricating fluid which prevents friction between the moving rotator cuff and the acromion. A false joint is formed by the convex surface of the posterior ribcage and the concave surface of the anterior scapula so that the shoulder blade glides against the ribcage. This joint is called scapulothoracic joint. The biceps tendon. The biceps tendon courses from the biceps muscle across the front of the shoulder in a groove in the humerus to the glenoid proximally. The very top of the glenoid, the biceps tendon attaches to the bone and actually becomes part of the labrum. This connection can be a source of problems from the biceps tendon is damaged and pulls away from its attachment to the glenoid. The deltoid muscle. The deltoid muscle forms the outer layer of the shoulder muscles. It is the largest and strongest muscle of the shoulder joint. The deltoid is the prime mover of arm abduction along the frontal plane. The trapezius muscle. It is one of the upper back muscles. It is a large triangular muscle that spans the upper back, shoulders and neck. The causes of shoulder pain. The different causes of shoulder pain include glenohumeral osteoarthritis. It is characterized by damage to the articular surfaces of the humeral head and/or glenoid. Shoulder labrum injury. The most common types of labral injuries are tears. They are divided into biceps attachment to the glenoid tear, superior labrum from anterior to posterior, slap, tears, Bankart lesion, antero-inferior labral tear, reverse Bankart lesion, postero-inferior labral tear. Joint capsule disorders. Frozen shoulder or adhesive capsulitis. It is a shoulder condition that limits your range of motion when the shoulder joint capsule becomes thicker and tighter. Acromioclavicular joint disorders. Acromioclavicular (AC) joint disorders can be classified into AC joint dislocation caused by acute injuries, AC joint osteoarthritis, distal clavicle osteolysis because of repetitive injuries, Sternoclavicular (SC) joint disorders. The most common disorders associated with the SC joint are dislocations and osteoarthritis. Rotator cuff disorders. The rotator cuff is a commonly injured area. The most common injuries are partial or complete tear, calcific tendinitis, calcification and tendon degeneration near the rotator cuff insertion to the humeral head. Bursa disorders. Bursitis. When a shoulder bursa gets irritated, it becomes inflamed, grows in size and become painful. Scapulothoracic joint disorders. Scapulothoracic bursitis and crepitus are disorders of the scapulothoracic articulation. Biceps tendon disorders. Conditions affecting the long head of biceps are biceps tendinitis, biceps tendon rupture, biceps instability, subluxation or dislocation. Muscular injuries. Trapezius muscle injury. The commonest injury is trapezius spasm. The chest muscles. The pectoralis major, which is the largest muscle of the chest, connects the front of the chest wall with the humerus. Injuries to the pectoralis major muscle are becoming more common. Injuries can range from contusions or partial tears of muscle belly or tendon to complete tears. Neurological disorders. Thoracic outlet syndrome. It is a neurovascular disorder resulting from compression of the nerves and/or vessels in the interval between the neck and axilla. Suprascapular neuropathy. Suprascapular nerve is responsible for the sensory innervation of the shoulder. Suprascapular neuropathy, or suprascapular nerve entrapment, is a condition which is due to irritation and damage to the suprascapular nerve in somewhere on its path. Suprascapular nerve entrapment is an uncommon condition that can be easily misdiagnosed. Vascular disorders. Osteonecrosis of the humeral head, it is also called avascular necrosis, AVN. It is in situ death of bone within the humeral head due to disruption of blood supply. Shoulder pain may be caused of dislocation or fracture of the bones due to a fall or trauma. You may experience shoulder pain due to tumor or infection. Shoulder pain in kids. Causes include the following: physeal injuries, little leaguer's shoulder, fractures, displaced or green stick fractures, infection, septic arthritis, or osteomyelitis, tumors. Little leaguer's shoulder is an overuse shoulder injury in overhead throwing young athletes resulting in epiphysiolysis of the proximal humerus. The arrow illustrates widened proximal humeral physes. It is classified as Salter-Harris grade 1. Referred shoulder pain. Unexplained shoulder pain that does not change when you move your neck, shoulder, or arm, or that occurs with symptoms elsewhere in your body, such as in your abdomen or chest, may be referred shoulder pain. Referred pain means that a problem exists somewhere else in the body other than where you feel the pain. Causes of referred shoulder pain may include neck problems, such as disc prolapse or cervical spondylosis, abdominal problems, such as gallstones or pancreatitis, heart problems, in which pain is more often felt in the left arm and shoulder, such as heart attack or pericarditis, lung problems, such as pneumonia, lung cancers. Diaphragmatic irritation can result in pain that radiates to the shoulder. This can occur in cases of liver abscess, ectopic pregnancy, etc. Symptoms. Apart from pain in your shoulder, you may also experience swelling, redness, warmth, inability to lift your arm or any object. Pain may be generalized or involve a specific region of the shoulder, such as the front or top of the joint. You may experience pain at night disrupting your sleep. The pain may resolve on its own, or may be persistent, requiring an evaluation and treatment. Diagnosis. When you present with shoulder pain, your doctor will review your symptoms and medical history. He will perform a physical examination. X-ray is ordered to view your shoulder joint and locate the actual cause of pain. You may also be asked to do MRI to evaluate the soft tissues of the shoulder, or a CT scan for better view of the bones. In certain cases, a diagnostic arthroscopy may be performed where the shoulder joint is inspected internally with a fiber optic camera. Treatment. To treat shoulder pain, your doctor may recommend rest and shoulder immobilization in sling. Avoiding activities that cause pain. He may refer you to physical therapy. Medications or injections to control pain and inflammation. Heat and ice packs may be applied to the area where you feel pain. Surgical intervention may be required for advanced cases of shoulder pain that cannot be treated by conventional methods of treatment. The common surgical procedures include arthroscopy or open surgery.